Good day everyone, we are the Group 4 Rapporteurs. I am Roslyn M. Kanyas, your first presenter. Today we will be discussing about the Chapter 6, Dimension of Development, Health Awareness. But before that, let's go over with the learning objectives of this lesson. At the end of this chapter, the learners are expected to first, name some common communicable and non-communicable diseases. Second, identify the causes and symptoms of these diseases. And third, enumerate and follow the preventive measures for these diseases. Did you know that there is a triangular model of disease that has three components? Well, those are the agent, host, and the environment. So diseases occurs when an external agent meets a susceptible host in an environment that allows the agent and the host to interact. And now, let's move on to communicable diseases. So when we say communicable diseases, it is one that is spread from one person to another through a variety of ways. It is caused by infections agents such as bacteria, viruses, fungi, and parasites. So what are some common infectious diseases? We have dengue, the common one. Hooker et al. 2007 mentioned in their book that dengue fever is a febrile disease caused by one of four closely related virus serotypes of the genus Flavivirus, family Flaviviridae, transmitted to humans by the Aedes aegypti mosquitoes that are found in the tropics. And its incubation or its process development period is from 3 to 15 days. And now for its signs and symptoms, dengue is manifested by a sudden onset of high fever with severe headache and muscle and joint pains, myalgia and arthralgia. It is also called breakbone fever or bone crusher disease. The patient may develop dengue rashes that are characteristically bright red petechiae. This usually appears first on the lower limbs and chest and spread to cover most of the body. The patient may suffer from gastritis, abdominal pain, nausea, vomiting, or diarrhea. Mild cases of dengue, where no rashes is present, can be misdiagnosed as the flu or other viral infection. Patient can pass on the infection through mosquitoes or blood products while they are still febrile. So how to prevent this infectious disease? Well, the best way to prevent is to avoid being bitten by mosquitoes. And here are the following tips on how to do it. So make sure that you take note of these followings. The first tip is use mosquito nets and insect repellent to protect and keep you from mosquito bites. Second, put screens on doors and windows to keep flies, mosquitoes, and all other unwanted pests out of the home. Third, refrain from going outdoors during the time of the day when mosquitoes are most active. Fourth, remove stagnant water as mosquitoes lay their eggs in standing water, so we must cover water containers and change water in flower waste frequently, as it significantly reduces the mosquitoes' population. And that's all for the first communicable diseases, which is dengue. And let's move on to another one that we will be discussed by our next presenter.
Thank you, Ms. Kanyas. Now I'll be reporting about the malaria. But first, let me introduce myself. My name is Yvonne J. Gomtang. Malaria is vector-borne infectious disease that is widespread in tropical and subtropical regions, including the Philippines. It is commonly associated with poverty, but is also an effect of poverty and a major hindrance to economic development. Malaria, according to Engelkirk 2007 and Barton's Microbiology of the Health Sciences, is one of the most common infectious diseases and enormous public health problems. It is caused by protozoan parasites of the genus Plasmodium. The most serious forms of the disease are caused by Plasmodium falciparum and Plasmodium vivax, but other related species can also infect humans. This group of human pathogenic Plasmodium species is usually referred to as malaria parasites. They are transmitted by female Anopheles and mosquitoes. Female Anopheles mosquitoes are the definitive host of Plasmodium parasites, the causative agents of malaria. Mosquitoes become infected when they ingest a blood of meal from a human carrying Plasmodium gametocytes. The sexual stage parasite is responsible for malaria parasite transmission. Furthermore, Plasmodium gametocytes are a stage in the life cycle of the Plasmodium parasites responsible for causing malaria. These are the sexual forms of the parasite that exist of the host bloodstream. When a mosquito carrying a parasite bites an infected person, it ingests gametocytes in the mosquito's gut. These gametes transform into a male and female gametes, ultimately fusing to form zygote. This zygote develops into a new sporozoite, which can infect another human when the mosquito bites again. Perpetuating the malaria cycle, gametocytes play a crucial role in transmission of the disease between humans and mosquitoes. So what are the signs and symptoms of malaria? The parasites multiply within the red blood cells and cause anemia, high fever, chills, nausea, headache, diarrhea, and even severe cases and worse, coma and death. And how to prevent it? Prevention of malaria can be prevented by avoiding mosquito bites through the use of mosquito nets and insect repellent, spraying insecticides, and draining standing water where mosquitoes lay their eggs. Malaria remains a significant global health challenge, particularly in regions with limited access to healthcare and resources. While preventable and treatable, it continues to cause illness and death, especially among more vulnerable populations. To combat this disease effectively, ongoing efforts in prevention, early diagnosis, and access to appropriate treatment are essential. International collaboration and research are crucial for the development of more effective prevention strategies and treatments. Ultimately, the goal is to reduce the burden of malaria, save lives, and improve the well-being of those at risk. Thank you for helping us spread awareness about malaria prevention and treatment. Together, we can make differences in the fight against these diseases.
Good day, my name is Joshua P. Kapoy from BSED SS1A. Our topic is about what is cholera and how to prevent cholera. Cholera is an acute intestinal infection caused by ingestion of food or water contaminated with a bacterium Vibrio cholera. It is a short incubation period lasting from less than 1 day to 5 days. It also produces an enterotoxin that causes corpses, painless, and water diarrhea that can quickly lead to severe dehydration and death if treatment is not promptly given. According to Hawker 2007, the incubation period of cholera is from 6 to 48 hours, but there are reported cases of people being infected during the period of diarrhea and up to 7 days after. We have the common signs and symptoms of cholera. We have these pictures. First, we have diarrhea, nausea, vomiting, and fever. And how to prevent cholera? So, follow these precautions to reduce the risk of contracting cholera. First, we need to wash our hands with soap and water frequently and thoroughly. So, number 2, drink safe water only. 3, eat food that is completely cooked. 4, avoid raw food or street food and any food from suspicious sources. Last, we have observed proper hygiene and sanitation at all times. Follow these precautions to avoid cholera, to have a good lifestyle and a better life.
Hi, my name is Michael Lagura and today I will discuss to you about the avian influenza, about bird flu. Avian influenza, also known as a bird flu, is a contagious viral disease that affects birds, particularly poultry. It can occasionally be transmitted to humans, but this is relatively rare. Bird flu domestic poultry through a direct contact with the affected birds or their droppings. In some cases, the virus can mutate, become too easy transmitted between humans, which is raises concern about potential pandemics. It is impact to monitor and control the spread avian influenza between prevent about outbreaks and protect both animal and human health.
The best way to avoid influenza infection is through vaccination, and also vaccines have some side effects. The common side effect of H1N1 vaccines are typical of flu vaccines are these following. First is flu shot. Soreness, redness, minor swelling at the shoot site, muscle ache, low-grade fever, and this does not usually last for more than 24 hours. And the second is nasal spray, runny nose, low-grade fever, vomiting, headache, wheezing, cough, and sore throat. The nasal spray vaccine contains live virus that has been altered to hinder its ability to replicate in human tissue. People with a surprised immune system should not get vaccine with nasal spray. And almost vaccines that contains flu viral particles are cultivated in eggs, so individuals with an allergy to eggs should not get the vaccine unless tested and advised by the doctors that they are cleared to obtain it.
Good day, sir. This is Cleope Pacifico, and the topic that I'm going to discuss is all about typhoid fever. Typhoid fever, also known as typhoid, is an acute illness most often caused by the Salmonella typhi bacteria or the Salmonella paratyphi, a related bacterium that leads to a less severe infection. And typhoid fever, isa itong life-threatening infection caused by the bacterium of Salmonella typhi na kapag hindi naagapan ay maaaring lumala. The bacteria are deposited in water or food na kapag ito ay nainom or nakain ay maaari itong kumalat sa ibang tao sa lugar. Ang typhoid is common worldwide and has received various names such as gastric liver abdominal typhus, infantile remittent fever, slow fever, nervous fever, or pythotic fever. The name typhoid means resembling typhus. Ibig sabihin, ang typhoid resemble ng typhus na nagmula sa neuropsychiatric symptoms na common din sa typhoid and typhus. Despite sa similarity ng mga pangalan nila, typhoid fever and typhus are distinct diseases that are caused by different species of bacteria. Ang isang tao ay madadiagnose ng typhoid fever kapag ang Salmonella bacteria is na-detect na merong dami ng dumi, merong iba't ibang klase ng dumi. Ang typhoid fever is ginagamot siya ng antibiotics. Approximately 3 to 5% sa mga pasyente, sila yung magiging carrier ng bacteria once ang infection ay naging isang matinding sakit. Patient with acute illness can contaminate the surroundings of supply of water sa pamamagitan ng dumi, which contains the high concentration of bacteria. Kapag ang supply ng tubig ay na-contaminate, in turn, masisira ang supply ng mga pagkain. Some patients suffer a very mild illness that goes unrecognized. So, sila yung mga patient na hindi na re-recognize. At the same time, sila yung patient can become a long-term carrier of the bacteria. Ang bacterium ay dumarami sa gallbladder, bile ducts, or liver and passes into the bowel. The bacteria can survive for weeks in the water or dried sewage. Here's the signs and symptoms of typhoid fever. People with typhoid fever usually have a prolonged high fever, chest congestion, abdominal pain, and discomfort are common. The fever becomes constant. Other symptoms include poor appetite, headache, body aches, and lethargy. Additionally, about 10% of patients have relapses after feeling better for 1 to 2 weeks. Relapses are actually more common in individuals treated with antibiotics, and for those who do not experience complication, improvement occurs in the 3rd and 4th weeks. Here's the prevention and treatment of typhoid fever. Typhoid fever can be prevented by drinking safe water, improving sanitation, eating well-cooked food while it's still hot, washing the hands often, and keeping the surroundings clean will help stop the spread of infections. There are 2 vaccines, one injected and the other given orally, are available. These are recommended especially to people in the high-risk area. Typhoid fever is treated with antibiotics that kill the Salmonella bacteria, as I said earlier. Prior to the use of antibiotics, the fatality rate was 20%. That occurred due to the napakaraming infeksyon, pneumonia, pagdurugo ng bituka o pagbubukas ng bituka. With antibiotics and supportive care, nabawasan ng 1 to 2% ang dami ng namatay. With appropriate antibiotic therapy, there is usually improvement with 1 to 2 days and recovery within 7 to 10 days. The carrier state, which occurs in 3 to 5% of those infected, can be treated with prolonged antibiotics. That concludes my report. Thank you.
Now I will be discussing the hypertension, or also known as high blood pressure. So, blood pressure refers to the force exerted by the circulating blood on the walls of blood vessels. It is one of the body's vital signs. So, hypertension is common but can be serious if not be treated. Blood pressure is the pressure of blood pushing against the walls of your arteries. So, arteries carry blood from your heart to other parts of your body. Your blood pressure normally rises and falls throughout the day. What do blood pressure numbers mean? The pressure is measured using 2 numbers. The first number, called systolic blood pressure, measures the pressure in your arteries when your heart beats. The second number, called diastolic blood pressure, measures the pressure in your arteries when your heart rests. If the measurements reads 120 systolic and 80 diastolic, you would say 120 over 80 or write 120 over 80 mmHg. We have here the 3 types of blood pressure. 1. Normal blood pressure. We can identify if the blood pressure is normal if the blood pressure reading is 120 over 80 or lower is considered normal. Number 2. High blood pressure. Blood pressure reading 140 over 90 or higher is considered high. If one or both numbers are usually high, you have high blood pressure or hypertension. 3. Low blood pressure. Blood pressure that is too low is known as hypotension. Hypotension or low blood pressure is when your blood pressure is lower than expected. So, dere na atay table sa high blood pressure range, normal blood pressure range, and sa low blood pressure range. For most people who are suffering from hypertension, there is no obvious cause why their blood pressure is high. So, this condition is called essential hypertension and is especially important that their blood pressure is kept under control. So here are some tips that changing your diet and lifestyle can do much in managing blood pressure. First, quit smoking. Second, limit the intake of alcoholic beverage. 3. Lose weight if you are overweight. 4. Exercise and eat well-balanced, nutritious meals that are low in fat, salt, and cholesterol but high in fiber. For example, ani nga mga pagkaon is beans, avocado, nuts, and brown rice. So, this can help you manage your blood pressure and to be healthy. Signs and symptoms of hypertension. So, general signs of high blood pressure include headache, dizziness, pounding in ears, and nosebleed. So, these symptoms typically do not occur until high blood pressure has reached an advanced and even possibly life-threatening stage.
So we must be careful in what we eat and do to our body because nakakamatay talaga itong hypertension. So we should also check our blood pressure regularly.
So now we are discussing cardiovascular diseases. So what do you mean by cardiovascular disease? So it refers to a group of conditions that affects the heart and blood vessels in our bodies. This condition can cause problems with the way our heart works and how blood flows through our arteries and veins. So the main reason why cardiovascular disease happens is due to a combination of factors including unhealthy lifestyle, habits, and genetic factors. So these two reasons are the main or common reason why cardiovascular disease exists. So as you can see in the screen, here are some key factors that contribute to the development of cardiovascular disease. So number 1 is smoking. Cigarette smokers are at a higher risk of developing cardiovascular disease compared to non-smokers. Why? Because the chemicals in tobacco smoke can damage the lining of blood vessels, causing them to narrow and restrict blood flow. So, number 2 is diabetes. People with diabetes have a higher risk too of having a cardiovascular disease because diabetes can increase levels of blood sugar, which can damage their blood vessels over time. So, we must avoid eating sweet foods. So number 3 is overweight. For example, someone who is significantly overweight may have a higher chance of developing heart failure due to the increased workload on the heart. So number 4 is saturated fats can increase LDL cholesterol levels, which contribute to the formation of plaque in the arteries. Consuming excessive salt can elevate blood pressure, increasing the risk of heart disease and stroke. So, number 5 is family history. If you have a family history of cardiovascular disease, your risk of developing it is higher. This is because certain genes and hereditary factors can make individuals more susceptible to heart problems. For example, if your parents or siblings have had heart attacks or other cardiovascular issues, you may be at an increased risk as well. So, number 6 is lack of exercise. So, dapat should mag-exercise no? So, not engaging in regular physical activity can increase the risk of cardiovascular disease. Exercise can help maintain a healthy weight, lower blood pressure, improve cholesterol levels, and reduces the risk of diabetes. Number 7 is age. Also, it increases the risk of other underlying conditions like high blood pressure and diabetes, which contribute to cardiovascular disease. So, kanang po impact ang age no para makakuha tayo ng sakit. So, number 8 is too much drinking. So, excessive alcohol consumption can be detrimental to heart health and increase the risk of cardiovascular disease. So, drinking alcohol in large amount can raise blood pressure, cause irregular heart rhythms, and contribute to obesity and high cholesterol level. So, number 10 is high blood pressure. Having uncontrolled high blood pressure, also known as hypertension, puts significant strain on the heart and blood vessels. Over time, high blood pressure can damage the arteries and weaken the heart. So, for instance, individual with untreated high cholesterol may experience a blockage in one of the coronary arteries, leading to a heart attack. So, kanang dapat should nga we are kanang careful ta sa ato ang mga gina-use. So, these 10 common causes of cardiovascular diseases. So, ako ang tambagan nyo kay maintain a healthy lifestyle, managing risk factors, and seeking regular medical checkups can help reduce the risk of developing cardiovascular disease.
Here are some types of cardiovascular disease. Heart attack. It occurs when the blood supply to the heart muscle is blocked, typically due to a clot in the coronary arteries. So, common symptoms of a heart attack include chest pain or discomfort, shortness of breath, and sweating. If you suspect someone is having a heart attack, call emergency services immediately and provide them with aspirin if available. It is the illustration of having a heart attack. So let's proceed in stroke. Stroke occurs when there is a disruption of blood flow to the brain. This disruption can be caused by a blockage in the blood vessel or ginatawag siya og ischemic stroke or by the rupture of a blood vessel, also called hemorrhagic stroke. I don't know if it is the right pronunciation, but hemorrhagic, siya. So the blockage or rupture prevents the brain from receiving the oxygen and nutrients it needs, leading to the death of brain cells. Here are some symptoms of stroke: sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Number 2 is confusion, trouble in speaking, poor vision, and sudden severe headache. If someone is experiencing these symptoms, it is crucial to call emergency services immediately and note that the time when the symptoms started, quick medical intervention can help minimize brain damage and improve the chances of recovery.
Prevention of cardiovascular diseases. Here are some tips on how to keep your heart healthy. First one is quit smoking. Second is control diabetes, blood pressure, and cholesterol level. Third one is exercise regularly. Fourth one is eat a diet that is rich in fiber and low in salt and saturated fat. 5 is maintain health weight. And last is manage your stress. Let's proceed in diabetes. Diabetes is the one of the disease that is really threatening to our body and our health. As we notice today, many people are suffering from this disease because they are delinquent in their health. They eat unhealthy food like sweet, candy, chocolate, soft drinks, and other sugary food. Diabetes is also happen when a person doesn't exercise anymore, always stay in bed, on the sofa, watching TV, or holding their smartphone. Being as physically inactive can also trigger diabetes, where your body doesn't function properly anymore. And now I will show you a short video that explains what is diabetes.
Medical term diabetes mellitus comes from the Greek word diabenein, meaning to go through or flow through, and from the Latin word mellitus, meaning sweet as honey. In everyday language, this metabolic condition is called diabetes. It usually occurs in the form of type 1 diabetes and type 2 diabetes and is shown as an excessive amount of sugar in the blood. But what causes it? Through the food we eat, we take in carbohydrates, which are converted by the stomach and liver into glucose. From there, they enter the bloodstream. Next, the pancreas releases the insulin hormone. This ensures that the muscle and fat cells open to absorb the energy-producing glucose, and the blood sugar level lowers. If this does not happen, the bloodstreams clot due to the excessive glucose content, the sugar level rises, and the organs suffer from low energy. This has different causes depending on the type of diabetes.
Good day, sir. Good day, classmates. I am Shilani Barana Tupas. For today's lesson, I'm going to tackle about some part of health awareness. So let's start. What is health awareness? When we talk about health awareness, it is a promotion of good health focuses on behavioral aspects, including immunizations of people. As a human, we will know how to start changing our lifestyles once we are aware of the risks involved. In this lesson, my learning outcome, in the end of this discussion, students will be able to identify what is diabetes. They will also be able to distinguish the types of diabetes. First, what is diabetes? Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Diabetes occurs when your blood glucose, also called blood sugar, is too high. Glucose is your body's main source of energy. Your body can make glucose, but glucose also came from the food you eat. Insulin is a hormone made by the pancreas that helps glucose get into your cells to be used for energy. There are three types of diabetes, which is number 1 is type 1 diabetes, number 2 type 2 diabetes, and lastly number 3 gestational diabetes. Type 1 diabetes, once known as juvenile diabetes, is a chronic condition. The pancreas makes little or no insulin. Insulin is a hormone that body uses to allow sugar or glucose to enter cells to produce energy. This reaction destroys the cells in the pancreas that makes insulin, which is called beta cells. Usually at the age of 0 to 40, young children or teens have this kind of diabetes. It is caused due to deficiency of insulin. Naay treatment for type diabetes 1, which is ang number 1 kay healthy eating and meal planning. Mao siya kanang magkuantang atong pangaunon is kanang mga healthy foods like vegetables, then mag meal planning ta kanang atong mga pag meal planning is kanang proper pud atong mga kaunon like dati ang kuan dapat permit ta mag-exercise, do some physical activity like magkuan po ta maglakaw-lakaw or some works nga dili pud kuan kaayo kanang hago or something nga dili lala. And then blood sugar check, always check nga sa imong blood sugar kanang dili ta mag palabi ka og tamis or something nga ana. And lastly is insulin injections. Mao siya ang mga treatment para sa type 1 diabetes. Type 2 diabetes occurs when the body doesn't produce enough insulin to function properly or the body cells don't react to insulin. This diabetes is often associated with obesity and tends to be diagnosed in older people. It is mostly affects on adults, usually ages of 40 plus, mostly adults but increasingly occurring in children and teens who are overweight and obese. It is caused due to insulin resistance by body, obesity, inactive lifestyle, hereditary are leading cause. Same sa type 1 diabetes, type 2 diabetes also have a treatment which is same rasab sa type 1 diabetes nga mag-meal planning and then healthy eating food like vegetables. Then ang meal planning nimo is kanang nakay proper way of meal planning, then increase physical activity like do some exercise or works nga kanara pong suitable sa imong lawas. Then blood sugar check as always kay diabetes ba na dili ta palabigo kaon og mga tamis nga foods. Gestational diabetes occurs when your body can't make enough insulin during your pregnancy. Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into the cells in your body for use as energy. If you have gestational diabetes, your baby is at higher risk of being large, which can make delivery more difficult. Ang treatment aning gestational diabetes is meal plans and scheduled physical health, which is same ra sa duha ka diabetes kagaina nga magkuan lang jud kag kaon og healthy foods and then do some exercise, magkuan kag mga work kanang exercise nga kanang kuan na pod suitable rin siya pon siya sa imuhang lawas. And then always check your sugar, blood sugar rather, and then eat more fiber foods like such as peas, lentils, and any types of beans, pinto, red, black, or garbanzo. These foods are high in fiber and help to keep your blood sugar levels lower than when you eat refined grains such as white bread and white rice.
I am Ginala Emperado, and for today I'm going to discuss the classification of cancers. Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. The classification of cancer that we're gonna tackle are the following: the carcinomas, the sarcomas, and the lymphomas, and also the leukemias, adenomas. First, we have carcinomas, are characterized by the cells that cover internal and external part of the body, such as lung, breast, and colon. So the example of internal cancer is the lungs cancer, breast cancer, and that's the colon cancer. That's what I said, internal. The example of external is the skin diseases. That's the example of external. Second is we have sarcomas, are characterized by cells that are located in the bone, cartilage, fat, connective tissue, muscle, and other supportive tissues. Example is the tumor of the bone. So this is the example of the sarcomas, the tumor of the bone. Number 3, we have lymphomas. Lymphomas are cancers that begin in the lymph nodes and immune system tissues. Example of this is the fluid of blood vessels, blood cells that turn into the blood infection. We have number 4, the leukemias. Leukemias are cancers that begin in the bone marrow and often accumulate in the blood streams. And number 5, we have the adenomas, are cancers that arise in the thyroid, pituitary gland, adrenal gland, and other glandular tissues. Under the thyroid gland, example is the goiter. So that's the target of the adenomas cancer, our thyroid pituitary gland. Always remember this quote of mine: let your food be your medicine, and let your medicine be your food.
So, signs and symptoms caused by cancer will vary depending on what part of the body is affected. Some general signs and symptoms associated with but not specific to cancer include fatigue, lump of area or thickening that can be felt under the skin, weight changes including unintended loss or gain, skin changes such as yellowing, darkening, or redness of the skin, sores that won't heal, or changes to existing moles, changes in bowel or bladder habits, persistent cough or trouble breathing, difficulty swallowing, hoarseness, persistent indigestion or discomfort after eating, persistent unexplained muscles or joint pain, persistent unexplained fevers or night sweats, and unexplained bleeding or bruising.
Good day, sir. I am Jalin de Tamosa. Today I am discussing about prevention of cancer. So first, we have no smoking. No smoking can lower the risk of several types of cancer. Most probably is in the lung cancer, throat, mouth, and liver. So kung nagapanagarelyo ka, so kinahanglan lang yun dapat nimo nga hinay-hinayon o undang ang pagpanigarilyo kay mo jud ni ang usa nga kanang makakos og cancer. So next, we have limit alcohol. So ang pag-inom og alcohol no is makakos gapon siya cancer sa mouth, esophagus, voice box og kanang tutoy sa babae, og atay og colon and rectum. So kung inom ang ganita og mga alcoholic no, so dapat limit lang. So ang sa lalaki is 2 glasses of kanang pag-inom, tapos ang sa babae is isa lang ka baso ang pag-inom sa mga alcoholic drinks. So ang ikatulo is eat healthy diet. Diet to prevent cancer. A lot of fruits and vegetables. They are rich in vitamin C. They contain antioxidant flavonoids. They protect from other diseases. A raw vegetable in each meal. Vitamin C only remains 5 hours in blood, so we have to take it through food frequently. And last, we have skin cancer prevention. Do not burn tan, seek shade, get vitamin D safely, ocean reflective, apply sunscreen, and protect clothing. Health is not valued till sickness comes.